think we're live. Actually, I think we're on.
Oh, wow. Okay.
Hey.
Hey.
Welcome.
Hello.
Welcome to Doc Talk Live. Hey, you want to join us? We're on live.
What you got?
Oh no, Dr. Congress online too. You want to tell her call you right back?
No, I gotta go.
Oh wow.
We can't even sit here for Congress.
All right. Well, you come back. You have to help me. All right. So Renee, I'm in Dr. Rossman's office.
Yes.
This is Renee, right?
Yes, Renee.
And you work with Dr. Rossman.
Yes,
you work
for
at the
3
front
years
desk.
now. Mm-hmm.
And we were just sitting around talking, and Dr. Rossman mentioned, I should look at the screen, Dr. Rossman mentioned that you could talk to us about pandas, and I told you how interested I am in pandas, which I know nothing about pandas. So in yesterday was Panda Day.
Yesterday was Panda Awareness Day.
Pandas Awareness Day.
Day.
So I don't know what panda is other than the bear in China, right?
Right.
So what is Pandas?
Pandas is pediatric autoimmune neuropsychiatric disorder associated with strep.
Wow. So pediatric autoimmune neuropsychiatric disorder associated with strep. So your son,
my son,
has pandas, so he had a strep infection.
Mm-hmm. He's 16 now.
And so what is the neuropsychiatric component?
Tics. Like, it can start with tics, anxiety. That's just some of the symptoms. His started with tics. It started when he was 10. He could not keep his, we started noticing he could not keep his head still.
Okay.
I've got a video of him laying in bed looking at his phone, and his head is just shaking constantly.
And I sort of got the impression, I mean, we really only sort of touched on this peripherally, but this must be incredibly hard to diagnose.
Oh, yeah.
Like how do you figure out it's panda associated, pandas, as opposed to just tic disorder?
Right.
And maybe we should back up. Can you tell our viewers, they may not know what a tic is.
Tic is like a movement disorder. It's either with your eyes, your head. The only way I know how to explain it is it being like a movement disorder. It can come with your face. His did. His was face tics, head tics. You can have verbal tics or movement tics, and his are movement.
Okay. And so how did was it misdiagnosed at first?
It was we went to his pediatrician, and he automatically said, let's check his strep titers.
Oh, so he had
strep.
He actually was sort of
strep can
on
cause
the right
tics.
on the right track. Okay.
Right. And so we checked the strep titers, and come to find out he had untreated strep in the past. They were very elevated, and that showed that he had untreated strep.
So it was diagnosed right away as pandas?
He would not mention pandas.
Okay.
He just said it was causing this movement disorder. So he sent us to a movement disorder specialist at Children's.
Okay.
Nothing there other than it's a movement disorder.
Well, I would imagine it's very hard to treat these movement disorders.
Yeah. So
Dr. Rossman's back. We've
sorry about that.
That's all right. We've determined at least what pandas are.
Yes.
Young child gets a strep infection, and it leads to a neuropsychiatric disorder.
Yes.
And her son had tics. That was how
at the beginning
that manifested. Is that a common way for it to manifest?
Mm-hmm. Yeah.
And apparently your pediatrician actually was sort of immediately checking strep titers.
Right.
So he was on the right track.
Mm-hmm.
I'm not a pediatrician, but that wouldn't have jumped to my mind. So,
but they wouldn't mention pandas. They wouldn't say that's what it was. We just recently found out.
Why would they not mention that? Any insight into that?
They just wanted to say it was a movement disorder. Because most people don't believe in it.
So if you put it in the pigeonhole of pandas, what does that do to treatment? Does that lead to treatments that you wouldn't or otherwise have?
Right.
So what kind of treatments if you can determine that this is pandas and not something else, what treatment does that lead to?
They all of a sudden, they put us on an antibiotic.
Okay.
And movements went away like that.
So even though they knew the strep titers were high,
No,
they didn't treat because there was no
they didn't treat at that time. Back
there was
when he
no
was 10.
symptoms of infection.
Right.
So the antibiotic has helped the movement disorder.
Yes. Well, now that he, 2 years ago, it came back. He had been good for about 2 years. Then it hit us hard again, to where it was more verbal tics this time, coughing, uncontrollably. Nobody would help me. Couldn't get any help here in Birmingham. I was on the Pandas website and found out Dr. Ashley in Dothan was a pediatrician that saw Pandas kids. Got with him. He was a lot of help.
Take me through this. How did you get to tick disorder, from tick disorder to pandas? How did you get there?
Wow, I'm trying to remember back.
Your neurologist.
Was it my neurologist?
Yes. So the neurologist thought, well, maybe this is a strep infection, autoantibody-driven disease process. And maybe this is one of those conditions where antibodies to the strep, similar to post-glomerular nephritis from strep infection, cause this neurogenic disease. And so with the antibiotics, we would give steroids, and that was an instantaneous fix. A dexamethasone injection with Rocephin injection would deplete the amount of antibody and deplete the population of strep at the same time.
So the steroids would deplete the antibody?
Yeah. And so
And the antibiotic would kill the bacteria.
And it would turn off the ticks for a while. But as anything, you would go into a remission and then you'd have a rebound. And so we were in remission for about 2 years, and then he had a rebound. And the rebound was debilitating because he couldn't sleep. He was coughing 24 hours a day.
Right.
I remember you said he had a cup. And if he was drinking or sipping, the gag reflex would override the cough.
Right.
And so if he had a cup to his lips 24 hours a day, 7 days a week, he could breathe. But he still couldn't sleep.
Right.
So he was out of school.
Out of school for several months. And
just
And you couldn't go back with the steroids, the antibiotic.
The steroids weren't as effective at that point in time, and so that was when immunoglobulin was started. And so he's being treated as if he has MS or an autoimmune disorder to the nervous system based on the strep, and that's the Pandas picture. It does present in a lot of different ways, but if it's not thought about, then it can become more and more debilitating and more concerning, and he lost months of school.
Oh, he was
Do you
homebound
think
for a
putting
long
him
time.
in remission led to a greater trigger the second time around, or do you think he would have progressed?
I think he never would have gotten any time off. I think he just would have progressed into a worse picture.
Into a worse picture.
Yeah.
And so now you treat this with IVIG?
Yes, or subcutaneous immunoglobulin.
And that is, you're basically trying to suppress the...
You're binding up multiple things with the immunoglobulin. You're going to bind up the neuron sites where the antibody is attacking. You're going to bind up the extra antibody that's not necessary. You're going to coat any white cells and be taken out of the system indiscriminately and hopefully get back to a place where you're in remission. So it has any immune target that you can think of. So hopefully it makes it to the point of remission and prolonged remission.
And I still am going to come back. How did you figure out, so you figured out this was Pandas.
No, she didn't figure out it was Pandas. She figured out pretty much the treatment for it.
The treatment. How did we get to Pandas? How did we get to, okay, we're in the Panda box here. How did we go from the tick box to the Panda box?
The neurologist neurologist recommended that it might be a strep based and said the word pandas.
And that's when I
And
got on
that's
the
when-
website.
That's when you came to me and
And
said,
you
I think
printed out.
they think he has pandas, and I figured out how you treat it and started from there.
Gotcha.
And that's when I got on the Pandas website, and I'm like, okay, this is Riley. He's having these
Yeah.
symptoms. This is him.
What is the Pandas website? Just
It's
pandas.org maybe?
It's
or?
Pandas. It's on Facebook.
Okay.
Pandas Advocacy and Support. They have one just here in Alabama,
Mm-hmm.
and that's where I found out about Dr. Ashley and Dothan.
Okay.
And he's the one that started us on the antibiotics.
Mm-hmm.
And Riley is still. We traveled to the Mayo Clinic in Minnesota
Mm-hmm.
before we found out it was, just to get the diagnosis of pandas. Nobody up there believed in it, and it was a wasted trip.
Mm-hmm.
So then,
So people don't even believe in this diagnosis.
right?
Yet,
They don't understand it yet.
yet there are treatments for it.
Yes.
So this is not like a syndrome. I despise the word syndrome because syndrome means doctor doesn't have a clue.
Right.
So this really isn't a syndrome, and you've got various treatments that this responds to. So how's he doing now?
He is absolutely wonderful right now, and it's only because of Dr. Rossman. Because I'm telling you, I was at the point. Me and my family, we didn't know what else to do, and I would come to work and I'd tell Dr. Rossman, "This is what's going on." She printed out this stuff. She talked to this doctor, in Florida. It's another doctor we went and seen. Conversed back and forth with him, and this is what we're going to do. And so every time, the coughing starts or he, gets an infection,
You bring him in.
She does the antibiotic and the steroid, and for a few days, and
He's back to fine.
back to normal.
Amazing. I appreciate you sharing your story. That wasn't too hard, was it?
No.
I don't know if there's any questions. I see some people are watching, but I can't tell if there's any questions. So we'll just go with that. We are in Dr. Rossman's office, Alabama Oncology. We're in Bessemer, and we're just in the break room. And so I want to thank you guys for doing that.
Thank
Appreciate
you.
it.
Thank
Good.
you.
That was fun. Thanks.
Thank you.
See, I'm going to leave it running because you guys will say some things. And that's really what I want to catch. You're not going to say, well, we should have talked about this, right? You're not
We
gonna do
should have talked about that one person did have tics, but the tics and the neurogenic changes that I read about when I was investigating was he became extremely OCD. And he had been in sports. And with his pandas, he went to the point where he couldn't go to the locker room. He wouldn't share someone else's glove. He wouldn't touch anything. And he's better now too, but he had an OCD almost like syndrome.
I think some of the problem is that since they're affecting sort of the psychological circuits, the behavioral circuits, it becomes even harder to ferret out that as a physical manifestation of a disease,
Right.
as opposed to a stress-induced reaction to whatever's going on.
Especially in the age group, because if they're a little bit older, people start to think schizophrenia.
Yeah.
I mean, it can be severe.
Yeah.
Like behavior. It can be. They had it on 2020 not too long ago, actually talking about it. And these kids that they interviewed, it was so severe. Talking about suicide, stuff like that, and
Terrible.
it can be really severe.
Right. Well, suicide would be a response to the disease, whereas the behavior would be from the disease.
Right.
Okay. All right.
Thank you.
Thank you.
Thank
Appreciate
you.
you taking the time.
Yes.
Yay!